What up? It's a tip of the week, and today we're going to discuss glucocortical steroids. What? Yeah, GSC for short. So you're going to be taking out tooth number 19 and doing an immediate implant. So what you want to do is make sure you get the chief complaint, pain scale, and review their medical history. Once you got all that information, why would I be giving a GSC? Well, one, it helps with edema. You have to remember that edema is going to be peaked at 48 to 72 hours. So let your patient know that, so they're not going to try to create a new hole for you after they have swollen up like a jellyfish. The next thing you want to take in consideration, how do you prevent it? Well, one, don't have a long surgery, aka get a coach. The next thing you want to do is don't put too much manipulation on the tissues because it's really going to cause more edema. The next thing you want to do is make sure they don't have any systemic disturbances. By doing that, you're decreasing the likelihood of creating this edema and the result of needing GSCs. The next thing you want to take into consideration is this. A glucocorticosteroid is basically a steroid that decreases inflammation and edema at the site where manipulation or surgery has taken place. By doing that, something to take into consideration, glucocorticosteroids focus on carbohydrates, while mineral corticosteroids focus on sodium. Just a little nugget for you. So when you're choosing a glucocorticosteroid, you want to make sure it has high anti-inflammatory properties, but very low mineralocorticosteroid effects as well, because you're going to be altering that sodium, causing more edema, depending on the site that you're working on. So a bonus for you is so that you could smile after surgery is this. One, 8 to 10 milligrams with GSCs can affect a patient who has post-op nausea and vomiting. Another thing is this. Don't use GSCs for patients who have diabetes because GSC will definitely affect the amount of insulin that's being able to be used, and it could potentially push a patient who is under controlled diabetic into a bad place. So once again, as you're working with your patients, you could use this IM, IV, and you could get the job done. And once again, my focus is for you to smile after surgery. Have a good one.